This is Talk to the Experts, a paid presentation from experts in their field. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of News Talk 770.
I'm Whitney Dean. You're listening to Talk to the Experts on News Talk 770, and you only have one of them, and that is your heart. And sometimes you don't realize that until something goes wrong or a family member has something goes wrong, especially when it is a heart attack or a heart event. And it can be scary, but there are ways to treat it and to help it along, to prevent it, and to really take that fear out of it as well. So Diamond Fernandez is founder and director of the HeartFit Clinic. You can find them at heartfit.ca. That's heartfit.ca. You can also phone them 403-870-4348. That's 403-870-4348. Or long distance, 1-877-700-4348. And he joins us in studio. Hello, Diamond.
Hello, how are you?
I'm good. Okay, so when people think heart attack and they get freaked out. So what does heart attack actually mean?
Well, there's different ways that people can have cardiovascular disease. I mean, a lot of people think of cardiovascular disease as a heart attack or a stroke, and that's just one aspect of it, but it's a very important one. So you look at cardiovascular disease, there's artery disease, there's valve disease, there's heart failure, there's arrhythmias or funny rhythms that are happening or regular heartbeats, what we kind of think about. So cardiovascular disease is all encompassing that way, and that's what we focus on at the HeartFit Clinic is really how to treat cardiovascular disease, but more importantly, how to prevent a heart attack or stroke.
And a lot of people worry about that. They think about their family history, but that's not everything when it comes to knowing as to what your heart health and what your heart is doing.
Yeah, and many people think, okay, I don't have a family history of it or I'm okay. But the truth of the matter is that the majority, a lot of people who end up with heart disease or cardiovascular disease have no family history of it. And it's just sometimes the way we live our life or what we're exposed to, or there's different avenues that we can talk about from that perspective. But, when you go to see what your risk is of a heart attack or stroke, you can go to your family doctor, which is important. They can do some important steps. But there's not much that they can do to see what your risk is. They can check your blood pressure. They can, check some blood work. They can check your cholesterol and diabetes.
That's always the big one. Do you have cholesterol?
Exactly.
Low cholesterol? I'm just fine.
Yeah, but, over 50% of people with normal cholesterol still end up with heart disease and strokes. So, is it cholesterol? And we'll talk about that in a little bit in a sec. But, your family doctor they can do those simple things to see, if you are at elevated risk. Mm-hmm. But what then? A lot of people are just left wondering, okay, well, my doctor said I'm okay, but I've been doing this for so long. I can't tell you how many people I've seen that have had a clean bill of health from their family doctor or even a cardiologist, which I'll explain in a second, and still end up with heart disease.
Yeah. People think, well, then I'll just eat better and exercise more and things will be just fine.
Yeah.
And what do you think about that?
Well, while those are very important things and things that we focus on in our clinic, when you look at cardiovascular disease and preventing it, there are a lot of things. First is to understand what your true cardiovascular disease risk is. And so, going on with that family doctor analogy, if you go see your family doctor and okay, well, I want to know what my risk is. Well, some of them send them to the HeartFit Clinic where we do some accurate screening tests to see where your risk is of a heart attack or stroke and give people a real picture. And then more importantly, provide them with tools and strategies to reverse the disease process or prevent that from ever happening.
Okay, so go to heartfit.ca or I call up, I make an appointment. Mm-hmm. What does an appointment look like at the HeartFit Clinic?
It depends because we see people who have cardiovascular disease. As I talked about, it could be artery disease, which is the most common. It could be valve disease. It could be congenital problems. It could be heart failure. Those are all big things that we help people with. And it depends on what your focus is. And to prevent a heart attack, we do a little bit more accurate screening tests. So we have So when you come into our clinic, we do some assessments. So one of them, of course, is to find a safe level for people to be exercising at, because exercise we think is the best medicine. Actually, we don't think. We preach that. Of course, that's one of the big things that we focus on. So we do that part of it. We hook you up with an ECG, monitor blood pressure, heart rate, oxygen levels, and find a safe level for people to be exercising.
Can you be exercising too hard or too low?
Well, and that's always a big question. People always wonder, well, I'm afraid. I heard someone, Alan Thicke had a heart attack here recently, and, all these celebrities, Princess Leia from Star Wars had a heart attack and, and passed away, unfortunately. And that's a woman and a young woman too. She obviously, people think it's a man's disease, but it's not necessarily. So, a lot of people can have heart disease and still, they wonder, okay, well, maybe I shouldn't play ice hockey. Maybe I shouldn't ski or whatever it is. And and our focus is, look, we want you to do the things that you love to do, but we want to make sure that you understand, your risk, and more importantly, do it safely and effectively. And, unfortunately, there's been a lot of celebrities in the last while that have had heart attacks and strokes, and people think, okay, well, it's not me or it can't happen to me. Well, the fact of the matter is, it's the number one cause of death of men and women, and it's the number one preventable disease. So continue on with some of the assessments of what we do. So when you come in, we do a clinical fitness assessment, and we look at your artery health a lot more closely.
Yeah.
So we do an artery screening test where we look right inside via ultrasound, and we measure the very first 2 layers of the arterial wall, so we can look right inside the arterial wall, and we come up with an age of that arterial wall. So that's one of the tests that we do. The another test is that your arteries are not a pipe.
Oh.
Yes.
That's what I've always visualized.
Yes, your arteries are not a pipe. We just can't go in there and scrape things out. So, for those who are listening, and if you're not driving, make a little circle with your hand and with your fingers, with your thumb and your first finger. That's what the inside of your arteries look like. It's skin. And so if I go in there with a rotor or do something that's harmful to the skin of the arterial wall, it can get inflamed.
Yeah.
And what happens? It gets red. It starts to, it doesn't look good. And so what happens to an inflammation response is that it can go through the process of atherosclerosis, which is starting to have plaque building up in the artery. So on that side of things, the artery is not a pipe. It's a muscle. And to give you a simple thing, the way people think about it, your heart is a pump. It's a very important pump. You only have one of them, and it does an important job. But to think about it, it's responsible for pumping blood all the way out to your fingers, all the way out to your toes, and then it's supposed to pump back to the heart. That's not the pump's responsibility anymore. It's your arteries. So your it's like a jumbo jet taking off. It uses the most fuel to take off and get in the sky. But when it's in the sky, it still needs fuel, right? Yeah. And so same idea with the heart's, taking off. It pushes the blood out. But to keep it going, the artery's got to do its job. It's a muscle. So it pushes the blood like a worm or a snake kind of feeling, and pushes the blood to where it needs to go. Yeah. So those are some. So another test that we do is to look at the function of the arteries and the health of the arteries. So we look at the health of the arteries, we look at the function of the arteries to make sure that they're functioning appropriately. And then we do some really great blood work to look at deficiencies in the blood. We have the ability to look at cholesterol with more detail.
Yeah. I think to some of the pictures you have on your website and you've shown me just before this interview today.
Yeah.
And when you think of arteries, or when people are when you're given pictures of your heart, if you've ever had some type of heart event, they'll show you the big arteries.
Yeah.
But you also look at the smaller arteries around a heart as well, not just those big ones that we think, that you stent those or you clean those out and that's what you worry about. You worry about all of it.
Exactly. And we'll talk about that a little bit later today, but what to do when you have a heart blockage. A lot of people don't have heart attacks that bring them to the hospital, so what to do in the heart blockage. Those are important things. I'll talk about that in a little bit in a second. So I'll get back to cholesterol.
Yeah.
Many people think that cholesterol is the reason why we end up with heart disease, and it's not necessarily true. Imagine that your artery is protected by a tennis net. And you have tennis ball sized particles and you have golf ball sized particles. The tennis balls won't go through a tennis net. They won't cause problems, but the golf balls will. And so what we do is, when you go to your doctor, they measure your good cholesterol, your bad cholesterol, and, the ugly, I call it the good, bad, and ugly. But not all of it is that bad, and not all of it is that good. And it matters about the size. And so sometimes people are being prescribed a cholesterol-lowering drug when maybe they shouldn't be. Or sometimes people are not being addressed their cholesterol when they should be. So what I mean by that is some people who have high cholesterol are taking a cholesterol-lowering medication, but they have a lot of tennis balls in their blood. And there's no need to, in my opinion, to take then a cholesterol-lowering drug. And so, and there's a lot of studies, this is what we call number needed to treat on different medications. There's a lot better things that you can do to really prevent a heart attack or stroke. And that's what we focus on in the HeartFit Clinic, is understanding what your cholesterol profile is. We also look at some key inflammatory markers to heart disease. I talked about this, when you put your finger and your thumb together, imagine that being the inside of your arterial wall, that's all skin there. And so if something gets inflamed, there are certain markers that get elevated with the blood work that we do. And so we can look at that part of it and see, are you at increased risk of a heart attack or stroke? And then we also have the ability to look at micronutrient deficiencies, because you have so many different biochemical pathways that it's hard to imagine all these different biochemical pathways. But if you're deficient in a specific nutrient, those are things that we can look at as well. People end up with high blood pressure. People end up with diabetes, dyslipidemia, which is abnormal cholesterol. They can end up with not sleeping well or whatever if you have deficiencies in your blood. So that's kind of all that we do with our assessments, and they're a pretty thorough assessment to kind of see what your cardiovascular disease risk is. And it's a lot more thorough than you get at your family doctor. But even going to a cardiologist, the only thing that they can do on a preventative basis to see what your risk is of a heart attack is a stress test. The problem with a stress test is that it'll only show advanced stages of a disease. So you could still be on the path of a heart attack or stroke and still pass the stress test with flying colors.
Oh.
Yeah.
Because people do those and they think, oh, see, I'm just fine and now I don't have to worry about this and check that off the list.
And that's wrong. And it bugs me, because how many times I've seen people who have had a stress test from a cardiologist or from a clinic that does stress tests here in Calgary, whatever, it doesn't matter. The point is that they do this test, yet they still end up with a heart attack, within a year. And they're like, oh, I've been given a clean bill of health, so I'm okay. Well, so let me explain that part quickly here, is that when you look at an artery blockage, an artery's got to be significantly blocked. Let's call it 80% blocked before it starts to show up on a stress test.
Okay, that's a lot of blockage. But then when do the majority of heart attacks occur then? So
the majority of heart attacks actually occur with blockages that are less than 50%. So you're given and the best way I can explain that is, imagine a plaque is like a pimple on your face, right? Everyone's had a pimple on your face. And what's the most bad thing that can happen to a pimple? It can explode and, bleed and pus, and don't mean to get disgusting, but everyone's had that before.
Yes.
Right? And so if that pimple is like a plaque inside your artery, and it's like, let's say 30% or 40% blocked, if that pimple is ready to explode or have a volcano explosion, all that pus and bleeding will come out into the artery, and that's where you end up with the majority of heart attacks.
Lots more questions now after you've just finished talking to Diamond Fernandez, founder and director of the HeartFit Clinic. You can find them heartfit.ca. That's heartfit.ca. Also, you can call them 403-870-4348. That's 403-870-4348. 4348. So coming up, wanting to talk more about the preventative measures that they have, the testing that can help you figure out what is going on with your heart and your heart health. And then also ECP, very special that they offer this in Calgary. And Diamond Fernandez knows a lot about this therapy, ECP therapy. We'll have that in just a moment. Talking to HeartFit on Talk to the Experts on News Talk 770.
You're listening to Talk to the Experts. This is a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of News Talk 770.
You're listening to Talk to the Experts on News Talk 770. I'm Whitney Dean. Diamond Fernandez is here, founder and director of HeartFit Clinic. You can find them heartfit.ca. That's heartfit.ca. Also, you can call them 403-870-4348. That's 403-870-4348. Okay, so Diamond, when we were talking, some of it came up, and I wanted to expand on this part, is the preventative part of heart disease, because people you know, a lot of people do end up with a heart attack, but you'd love to not have one to begin with.
Of course, yeah. You know, when you go see a cardiologist, which is important, of course.
Yeah.
On a non-invasive basis, there is only a few tests that they can do to see what your risk is. And so they can do, most of the time they do a stress test. And like we talked about before the break, is that the majority of heart attacks occur with blockages that are less than 50%. And here you have a stress test that is only going to show advanced stages of the disease. So we're only looking for, if you're not high risk, you tend to get dismissed from a cardiologist. That's just what it is.
Yeah.
I mean, they're very busy people. And so,
they're only dealing with the worst cases, really. That's what happens.
Yeah, and that's what happens. And so, you know, the next level is that, let's say we do find something from a stress test, and we say, okay, well, the cardiologist says, well, let's do this other test, and it's a dye test, and they call it non-invasive, but it's about 700 chest x-rays, and, you know, it's a radioactive dye that goes inside of you, and it's not there's a time and place for doing that test, of course, but the point is that if they find something on that test, then they send you to an angiogram. And a lot of people know what an angiogram is. It's where they now insert the catheter through your arm, and they get right to the aorta, and they can see now the arteries of the heart, and they can see what is blocked. And doing an angiogram on a preventative basis there's a time and place for that as well. But, you know, you have to, if you're walking in with your own volition to the hospital to get an angiogram, you're going to end up probably with a stent or a bypass surgery or maybe medical treatment. And on a preventative basis, so that's now we're
you haven't even had a heart event. You just went in because you're like, I'm interested in how my heart's doing.
Yeah, and that's the wrong way to treat heart disease.
Yeah.
That's what we call stable coronary artery disease. And when you have stable heart disease, it's like going in there and let me disrupt that pimple that is ready to explode and put a stent or bypass it. And that's not the best treatment option. So we have a much better treatment option that's available, and it's safe, it's non-invasive, and even if you wanted to go conventional, let's say 100% conventional treatment, meaning that a stent and medical therapy, we're almost getting the same outcomes.
Yeah.
People think that a heart stent is going to save your life, or a bypass surgery is going to save your life or make my life live longer. That's not necessarily true. Lifestyle change is what we focus on in the Heart Fit Clinic, with exercise, nutrition, and proper supplements in place are going to be much better for you to really, truly live longer with heart disease. But we also have a really great treatment option, which is called external counterpulsation therapy. Now, if someone has, in my opinion, anyone who has cardiovascular disease, anyone who has heart failure, this is an amazing treatment option for people to live longer and live better with cardiovascular disease.
Okay, so what is ECP therapy? Can you say the long version again?
Yeah.
What is it again?
So ECP is external counterpulsation therapy.
Okay.
And for those people who have heart blockages, hypertension, diabetes, it's heart failure. What happens is that now what we're doing is patients lie on this bed. It's a non-invasive treatment. It's a very evidence-based. It's alternative, meaning that it's not in mainstream. Not everyone's doing it. But this treatment's available, you know, in the States. It's covered through Medicare in the States. It's available in Europe. It's being recognized by cardiology societies, so the European Cardiology Society. It's in their consensus there. It's in the American Heart Association. So it's a very evidence-based treatment. Why it's not adopted here, that's beyond me. I don't want to get into the political side of things, but we do that at the Heart Fit Clinic, and we're the only ones that do this treatment at the Heart Fit Clinic. If people have cardiovascular disease, your heart's a pump, and your arteries are a muscle, and we talked about that already. And to improve the inner lining of an arterial wall, ECP does that. So what happens is that patients lay on a bed, they have blood pressure cuffs on your calves, your thighs, and your buttocks.
Okay.
And so what happens is that we put an ECG on you, so you're now timed to your heart rhythm. And every time your heart contracts, the cuffs relax. Every time the heart relaxes, the cuffs contract. And so they sequentially inflate from the calves, thighs, and buttocks, and it pumps blood back up to the heart. And it's doing this timed with your cardiac cycle. So what happens is that now we get a huge volume of blood being pumped up to the heart. And what happens that we see with that continual treatment, so patients lay on this bed for an hour each time the treatment, and they do a number of treatment sessions to have this benefit that way. So if we did this, for 10 minutes, you're not going to see too much changes. But for an hour, you're going to see some amazing benefits that way. And so what happens is that we pump the arteries back up to the heart, the blood flow back up to the heart. And now when the heart's pumping, it's pumping a greater volume of blood. So a few things that we see. We see improvement in heart function. Mm-hmm. We see the process of angiogenesis, which is the growth of new arteries. And I showed you an image here earlier, and it's all on our website, of course, and we're happy to share with everyone, is that your hearts have the ability to have so many different vasculature, so much capillaries that can go to the endings of the heart. And if your heart's been compromised for whatever reason, you've had a heart event, heart failure, you have heart blockages, this is a much better treatment option to now reverse that process and to improve your heart function. And we've seen that many times. We've seen people who have bypass or on the list for bypass surgery and not having to do bypass surgery.
Wow. That is big.
We've had people that are needing a heart stent by the cardiologist, but they said, well, you know what, I don't want to do it right away. And instead they come to us, and then now they don't need that heart stent anymore. We've had people that have been in heart failure and now get out of heart failure. It's like there's a certain threshold as to when that can happen, but it's amazing benefits that we see. And just one patient after another, we've been doing it, we see one benefit after another. Obviously, there's lots of testimonials and patients that are doing that, and we're happy to share them with people because, and we don't, we have nothing to hide from that perspective. They just love, we're giving people's lives back.
And then also you have the testing afterwards to show, here's where your heart is now.
Exactly. Patients can do echocardiograms, which are ultrasounds of the heart. They do them before and after, and heart functions, or what we call ejection fractions, double. We've seen tissue that is not viable, meaning that it's not getting blood flow, start to get blood flow.
And does that take a lot of anxiety, especially from patients who've had a heart attack or a heart event before?
Yeah.
Does that relieve some of their anxiety? Because I feel like you continue on after a heart attack, you always feel like you're walking a little bit of ice every once in a while, or on borrowed time a bit.
Of course. And, as a cardiac rehab clinic, that's what we focus on, is obviously ensuring that people can live longer with heart disease. Mm-hmm. But now with ECP therapy in our pocket, we're able to truly, really make a difference in people's lives. If you've had a heart attack or a heart event, now you got a stent or a bypass surgery, you wonder, you're like, how long is this going to last for? Mm-hmm. Are my bypass grafts going to close up? Because it's not forever. Mm-hmm. A stent doesn't last forever. There's some cool videos I got on our YouTube channel that you can check out. But, when you look at a stent, it's got to be positioned extremely well for it to take to the endothelial lining, the inner lining of the arterial wall. Mm-hmm. If it's out of place, I've seen some bad situations with stents. And I've also seen stents last many years, but you're always going through your mind, okay, well, I got a little chest pain, what's going on? And that's what we focus on in the HeartFit Clinic. We do assessments to make sure people are on track with their supplements, with their nutrition, with their exercise. And then ECP therapy is just an amazing treatment option to help people grow new arteries. They have heart disease. Well, we can help with that.
Yeah. Talking to Diamond Fernandez, founder and director of the HeartFit Clinic. You can find them heartfit.ca. Also 403-870-4348. That's 403-870-4348. Also long distance, 1-877-700-4348. We'll be back in just a moment on News Talk 770.
You're listening to Talk to the Experts. This is a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of News Talk 770.
Talking to the HeartFit Clinic. Diamond Fernandez is founder and director of the HeartFit Clinic. You can find them heartfit.ca. That's heartfit.ca. Also phone them 403-870-4348. That's 403-870-4348. And, okay, Diamond, we've been talking about ECP, which has me very excited about what it does for people, either prevention or for afterwards as well when it comes to heart attacks or heart disease. But ECP, you were mentioning just a little bit earlier, Europe seems to recognize it, the States seems to recognize it, but really, in Canada, you're one of the few that are offering it.
Yeah, we're one of just probably, I think, 3 or 4 centers that offer it here in all of Canada. Yeah.
So that's pretty special. So where in the past, what kind of, I guess, hoops did people have to jump through to try to get this type of procedure?
Yeah, many people had to fly down to the States to get it done. And there's some really great clinics that do it in the States, but now you don't have to do that. You come to a great clinic like ours in Calgary. And, with our clinic, we've had people fly from out eastern Canada to us to, we've had people from Europe come see us. People come to see us because we have this treatment option that are available to people. But more importantly, we do it. I've seen the clinics in the States and how they do it, the treatments, and they're very good. But one thing that I really thrive on with our staff and with our clinic is it's a personalized approach to people's heart health. Everyone's different. People have heart disease for different reasons.
Well, that, and I think even just experiences in Canada when you go to your family doctor and you want to talk about your heart or any other medical issues, you have a few minutes and then that's it. And that's not the case when you go in to see you.
Yeah, and there's a campaign going out now that talks about choosing wisely. So we got to choose wisely as to what tests that family doctors are starting to do. Our healthcare is burdened, and to try and fix that is
something else.
It's another story altogether.
I'll stay out of that. Yeah.
But that's not my job, nor do I want to get into that aspect of it. But my focus is to help people with their heart health and to provide them with all the knowledge so that they can make the informed decisions to help people with their heart health. It's you only have one heart. And you got to take care of it and you got to treat it well. And sometimes we abuse it. Sometimes we, especially with the holidays, there's a lot of people that have called us and end up with holiday heart attacks. We call them, and so it's a stressful time of year, and there are many things as to what can trigger it. And your family doctor, it's hard for them to take that time, like you said, and really focus on what can I do to prevent a heart attack or stroke. And more importantly, if they send you to a cardiologist, if you're not high risk, you just get dismissed.
Yeah, you'll be dismissed. You'll put it at the bottom of the list. Or I can see your family doctor would say, you know what, I don't think you need that. We ran a couple blood tests. You don't need that, and you're good to go. And you don't really know what's going on in there.
Yeah, checking your cholesterol, it's a coin flip. It's like, okay, well, your cholesterol is good. Your medications are doing what they're supposed to. Your blood pressure is good, but you could still be on this path of a heart attack or stroke, or and you don't know.
Yeah.
You just don't know. And the testing that's available in our healthcare system is limited, and more importantly, it's not the best. What is the best treatment option? Like at the end of the day, what is the goal for that patient? Is to help them with their heart health. And sometimes conventional medicine may not be the best option for that patient. And I'm not saying that it should never be done. Absolutely, there's a time and place when people should get intervention done, whether it be a stent or bypass surgery. But you look at things, and people can Google this. It's just called number needed to treat. And if you look on any medication, you're taking a chance. You're like, okay, I'm going to take this cocktail of medications, and that's going to help me, prevent a heart attack. And you're like, yeah, maybe not. If you look at the odds, it's not that good. You're better off going to the roulette table and trying to win there.
That, or it takes forever to find and I'm speaking from my own personal experience because my husband had a heart attack at 47.
Yeah.
And it's finding that perfect mix of some drugs that they need to be on. And a lot of times you need less or more and all of this, when really you could do something like this program and you'd have someone really looking at what you're doing, what your health is, and finding some other options than all of those medications.
Yeah. And so when people are doing external counterpulsation therapy with our program, ECP therapy, you're with a nurse, you're with one of our cardiac specialists, a cardiac rehab specialist, and, they're going to talk to you about your food. They're going to talk to you about your exercise. We want you to live longer, and that's what our focus is that we're sitting with you for an hour at a time doing this treatments, and you get to know people, and the benefits that we see from people are just amazing.
And I think you'd also be able to keep someone accountable as well, because it's all well and good to go into a doctor's appointment and it's like, okay, here's just like a booklet on some things. We'll see you later and good luck with that. Yeah. And that's not what you guys are up to.
No. And even if you didn't do anything else, let's say, you wanted to live the life way you wanted to do it, That's fine. People do that. Just you can't change people all the time. That's not where focus is. But with ECP therapy, with external counterpulsation therapy, having the ability for your heart to grow new arteries and improve heart function and improve exercise capacity. If people have angina pain or chest pains, this is a much better treatment option than going to your cardiologist and trying to get a heart stent or a bypass surgery, because there's a difference between having a heart attack and having angina or chest pains or having a heart blockage. There's differences there. If you're having a heart attack, get yourself to the hospital as quick as possible. You want to get a heart stent and open up that artery as quick as possible. Absolutely. If you're having a heart attack, that's not our focus. Our focus is after that. We're a rehab clinic. But those who are coming through the path and trying to find out what their risk is or have heart disease and now want to know where they are, they're lost. I know that for a fact. I've been doing this for a long time now, and people get lost in the healthcare system. You just don't know, okay, well, until you're high, that's where cardiologists excel, is in the hospital. When you're at risk, it's an emergency, that's what they do best. That's what they do best.
But the before and afterwards.
Yeah, it's, we just say, okay, make sure you take your drugs and, you might want to try that exercise once in a while, but it's not really the focus.
Yeah.
There's studies that are done on comparing stents and bypass surgery. There's studies, we know that. There's studies that are done between having a stent and exercise, having stent and medication therapy. We find that there's better treatment options with natural ways, with exercise, with taking medications. It's a much better treatment option than going in there. It's an invasive test. People think, okay, well, I'm just going to get this cardiologist to open up my artery and I'm good to go. I've opened up my pipe. My pipes are clean.
Yes.
Those are terminologies that we hear. Or I got new arteries. And that's such it irks me when I hear that aspect of it, because that's not true. Your arteries are a muscle. Yeah. They're not a pipe.
That, and then it also, for some people, they get a little scared when after a heart attack and doing their rehabilitation. But then also, for some people, it gives them a false sense of security. Oh, I got a stent in, so clearly I'm fine now, and I don't have to change anything, and it's going to be okay.
Yeah, that can happen, which is fine. But heart stents, and according to the literature, they'll last anywhere from 5 to 7 years.
That's not that long.
And on average, that's what they say, and so.
And to have a way that your heart can actually get better afterwards.
Yeah.
Like better than before the stent.
But here's what I really want to say. At the HeartFit Clinic, we focus on the whole artery.
Yeah.
If you think about a heart stent and let's say you have a blockage in your left artery, whatever it is, we'll call it. And we put in this little metal mesh and we open up that artery. What do you think the health of the rest of that artery is? Do you think it's completely okay? Or we're just kind of opening up a blockage there? We focus on the whole health of that arterial wall. And the only way you can do that is by natural treatment options. There's nothing else. You can't go in there with a rotor and clean it out. You can't just all of a sudden give, a magic pill and all of a sudden you got this clearer arteries that start to flow perfectly and deliver blood flow where it needs to go. It doesn't happen that way.
Yeah. Talking to Diamond Fernandez, founder and director of the HeartFit Clinic. Heartfit.ca is the website, heartfit.ca. Also, you can phone them, 403-870-4348. That's 403-870-4348, or long distance, 1-877-700-4348. We'll be back on News Talk 770.
You're listening to Talk to the Experts. This is a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of News Talk 770.
I'm Whitney Dean. You're listening to Talk to the Experts on News Talk 770, talking to the founder and director of the HeartFit Clinic, Diamond Fernandez. You can find them heartfit.ca. That's heartfit.ca. Also 403-870-4348. That's 403-870-4348. Also 1-877-700-4348 for long distance. Okay, Diamond. So when you are going to the HeartFit Clinic, you guys, what is an assessment process looks like? What happens?
So, when you find out, like when you go to your family doctor, and let's say people always ask us, okay, what's the difference between us and going to your family doctor?
Yeah.
And that's always a big question that we get. And you only have a few minutes with your family doctor, and even if they do a very thorough physical, they only have blood work at their disposal to kind of see.
And they don't specialize in it. A family doctor has to know a lot of different things.
And so, yeah, we have, for those who are family doctors and or not referring to us, I mean, we do events for family doctors all the time to have them understand how to help people with their heart health and really understand that part of it. So when you go to that doctor, they can check your cholesterol and blood pressure and check your diabetes risk and whatnot. But our focus at the Hartford Clinic is to look right inside arteries and look at artery function and health. And so one of the tests that we do is an ultrasound test where we look right inside the arterial wall and find, what the thickness of the arterial wall is and give you an age of the arterial wall. Another test that we do is we talked about the muscles are not, the arteries are not a muscle. Not a pipe,
Yeah.
But they're a muscle. And so the arteries should be functioning well. And so we do an artery function test and look at the reactivity of the arteries. We do some really great blood work where we can see what is your risk of a heart attack or stroke. Over 50%, or the majority of heart attacks actually occur with blockages that are less than 50%. These are blockages that even if you did an angiogram with a cardiologist, they'd be like, okay, well, it's not bad enough. We can't do something to it. So continue as you are. Take these medications and, we'll hope for the best that way.
Yeah.
And that's not the right way either. And so what we do is we do some blood work. We look at inflammation markers. We look at inside a blockage and see what your risk is. There's some markers that get elevated that way or inside the artery itself. And then we look at cholesterol with more detail. Not all good cholesterol is good and not all bad cholesterol is bad. And we talk about that as well. And so your artery is protected by a tennis net and you have tennis ball sized particles and you have golf ball sized particles. It's the golf balls that are more dangerous and that people don't necessarily realize that they could be having more cholesterol. We could have normal cholesterol, And that's why the majority of heart attacks and strokes actually occur with people with normal cholesterol. They have a normal cholesterol profile. They have no at all signs of anything and not even family history for that matter, and still end up with heart disease.
And that's, I think for a lot of people, they listen to this and they think, oh, you know what, but I don't smoke. I think I eat pretty well and get some exercise in there. This just isn't about me and I don't have to worry about it. Mm-hmm. And what would you say to someone like that?
How many people I've seen over the years that have a look healthy and still end up with heart disease? You can't tell what's going on inside your body.
Yeah.
People think, okay, I'm a little bit overweight. I got a few pounds to lose. But do you know what's going on inside your arteries? Do you know what the health of your arteries are? Do you know what's going on inside of blood work or any deficiencies in your blood that you're unaware of? Those are things that many people who smoke, okay, yeah, your risk of heart disease. That's a no-brainer. But a lot of people who have heart disease don't smoke.
Yeah, I think
and are not even overweight for that matter.
Yeah, my husband, again, I mentioned he had a heart attack at 47, but not overweight, he quit smoking for 10 years, has a heart event, and sometimes you just need someone also to really look at your lifestyle, and for him it was stress. But you don't really think of that or other factors until you really get a chance to sit down and look at that with someone with all the risk factors and what's going on in your life and have those tests.
Yeah, and while all those are very important, that part of it, but when your arteries get damaged, they're damaged.
Yeah.
Right? And the best way to treat that damage, or whether it be if you've had a heart stent or bypass surgery in the past, and, people don't know this, but I think it's on our website, is that why I got into this field is that my father had a heart attack, and he had it at a young age. He was 38 when he had his first heart attack. And I'm 41.
That's young.
And I'm 41 today. And at 42, he had bypass surgery. Now, obviously, he's doing well. We celebrated his 70th birthday last year, and it took him a while to come and see us. And, I opened up our Heart Fit clinic, cause I started with Total Cardiology, group here in Calgary, and I had some really great mentors, starting my profession in cardiac rehab. And, I left them, opened up a clinic in Dubai. And then I said, okay, well, do I want to follow this conventional approach, or do I started to see some really great benefits from doing ECP therapy, external counterpulsation therapy. And I said, well, this is definitely something I want to bring to Calgary. And I opened up the clinic in 2007, and it took a while for my dad to actually come in and do the treatment with us. But I mean, he had bypass surgery. His grafts closed up. They tried to do stents and restents and all this stuff. And, he's going into heart failure, basically. And so he did our treatments, and, he's a walking testimonial for us, not only because his son's doing it, but we got, hundreds of people like that, where they've done our program, seen benefits, and now continue on this path of living longer with heart disease. That's our focus.
Yeah, and so that is one of your treatment options is ECP.
Yeah, and external counterpulsation therapy, like we talked about, it's these cuffs that pump blood back up to your heart. And you lay on this bed and it's painless. It's feels like a little bit of a massage, and patients talk about it on our website. There's a few people that talk about how we're giving their life back instead of, if you have angina pains, if you have chest pains, those are warning signs. Now, the chances of you actually having a heart attack at that point, if it's a heart attack, get yourself to the hospital as quick as possible. That's not our focus. But if you have angina, if you have chest pains that are happening and you're not sure what's going on, and you're not what we call stable coronary artery disease, that's the best treatment option that we have for people is external counterpulsation therapy. If you're in heart failure, it's amazing. We've taken people out of heart failure, improved their heart function. And people realize, and doctors are a little bit, puzzled. They're like, that's good. I'm glad that worked for you. But, maybe it was the medications that we were giving you. And, I shake my head because it's a very well evidence-based treatment option for people all over the world except for, Canada, really.
Mm-hmm. Any of the testing before and afterwards?
Yeah, we do the testing before or afters to show the benefits. All over in the States are doing this, in the Mayo Clinic and, Cedars-Sinai, some big centers are doing this treatment. And it's not by accident. There's thousands of testimonials online that you can find from other centers and show that. And you don't have to fly to those centers anymore. We do that at the HeartFit Clinic.
Well, happy to have you in here. You know your stuff when it comes to this, and you can find it all on your website. Well, thank you very much, Diamond. I appreciate your time today.
Thank you very much.
Diamond Fernandez, founder, director of HeartFit Clinic. Again, heartfit.ca is the website, heartfit.ca. Also their phone number, 403-870-4348, 403-870-4348. They are right here in Calgary. You can also call them long distance, 1-877-700-4348. That's 1-877-700-4348. You've been listening to the HeartFit Clinic on Talk to the Experts on News Talk 770.